Hi, this is Dr. Mays with Emergence Teleradiology. I just want to go over a few things today so we can discuss some techniques and images that will help us when we're trying to image the facial structure. So whether we're imaging for facial trauma or sinus disease or even possible infection, there's some different images that we want to make sure that we take so we can get the most information possible. So the first thing is just to go over a list of the different types of exams that are out there that we may be potentially using. You can see on here we have the Waters view, the Caldwell view, the Townes view, and the lateral view. Those are the ones that everybody's pretty familiar with, but also we want to make sure we know how to do the basal view as well as have a nasal bone view and the orthopanthomogram, and potentially an oblique Townes view could be helpful as well. So this is an example of the Waters view, and you can see here we have a good look at the nasal septum. We can see the orbits right here, so the orbital walls, the rim of the orbits here and here. We have a good view of the maxillary sinuses right here and the mandible right there. So if there's a mandibular fracture, we may be able to see it here. On this view here, we can kind of see the mandibular condyles on this side. This side we can't see it so well, but it's over there. We see the mastoid air cells over here and over here. And then the zygomatic arches are here. They're kind of overlapping with some other structures, so this is not the ideal view for looking at the zygomatic arch, but you can look at it this way as well. And then up here we see the frontal sinuses, so this is aeration of the frontal sinuses. We can also look for like a subtle step off of the cortex here. If someone has a skull fracture, this would be a way to pick it up. This is an image of the Caldwell view. So this is more of a straight on view. And again, we see a lot of the same structures, but now we're looking straight on rather than on the Waters view, we're kind of looking up from the bottom up. So you can see the structures, the nasal septum here, you see the maxillary sinuses here and here. They overlap a little bit with some of the other structures, but we'll still be able to see some opacification. We see the orbits right here and right here. And we see the mandible. It's a pretty decent look at the mandible, but you notice we really don't see the temporal mandibular joints on the Caldwell view very well. This view is called the Townes view, and this one is kind of if you're looking down at the feet. So imaging is projected downwards and it's elongating the jaw so we can see the mandible here. You get a pretty decent look at it. Again, we don't still completely see the temporal mandibular joints here. We can see part of it, but we don't really see the entire condyle. But the thing we do pick up here is now we're starting to see the zygomatic arches right here, and also right over here is a good view of the zygomatic arch. The orbits, you can see we don't see very well at this point. They're kind of being compressed down on themselves. This is a lateral view. And on the lateral view, we do have a very good look at the temporal mandibular joints. So this is the fossa for the coronoid process. So this is the coronoid process of the mandible, and this is the mandibular fossa where it fits in. So if there's a trauma here, so there's a fracture, we have a pretty good shot at picking it up here. Fractures typically occur in two places on the mandible. So more than likely, if you have it on one side, you're going to have another fracture on the other side, not necessarily the exact same place, but so typical locations, the angle of the mandible, sometimes in the ramus of the mandible, and then certainly in the mental process anteriorly we'll see fractures. On this view, you can also see the maxillary sinus. You can see the osseous sella where the pituitary gland is located right here. This part here is the planum sphenoidale. And you know, obviously, if you have someone with a big meningioma, sometimes you can see disruption of the planum sphenoidale. On this view here, you can see the frontal sinuses if you get them lined up absolutely correctly, but it's going to be a little bit tough to always see that. You'll notice that if we do a good job with this image, we don't really see the nasal bones. So if you're seeing the nasal bones on your lateral view, you're probably not getting the correct penetration for that patient. This is a view, it's an extra view that's called the basal view, and this one is really helpful to look at the zygomatic arches. So you can see the zygomatic arch out here, the other zygomatic arch out here. You can also see the pterygoid processes right here and right here. Over here is the pterygoid process. You can see the posterior wall of the maxillary sinus, and we also see the nasal septum right here, and the hard palate is right there. Now you notice on this one, how I said if we do a lateral view, we typically don't see the nasal bones, but this is a view particularly interested in looking at the nasal bones. So we have a good view of the nasal bones, but you notice now we don't really see the temporomandibular joint. And you know, like I said, if we're seeing both of them, our penetration is probably not set exactly right, so we want to adjust that. This is the nasal frontal suture right here. You can see a line there sometimes, but you shouldn't see a line right here. So a line right there, as in this case, is a nasal bone fracture. And then this is the orthopanthomogram, which a lot of times we're probably not going to be able to do it in a mobile industry, but you still may do it in a hospital setting. Some urgent cares, things like that, may have access to this view. It's really good at looking at the mandible for fracture. So we can see everything on this view. So everything from the mandibular condyle here, and the angle of the mandible, the ramus of the mandible, the mental process, and coming all the way around. The other thing that's helpful here, as you can see in this image, when we're numbering the teeth, we start here. So in the middle, number 8, number 7, 6, 5, 4, 3, 2. And a lot of times we won't see number 1. This patient doesn't have a number 1. On the other side, this is 9. This would be 10, 11, 12, 13, 14, 15. They don't have 16. And then it's kind of the same thing, 25 going around, 24 going around that way. So 24, 23, 22, 26, 27, 28. And this kind of goes through that as well, just giving you an idea of how to number those. So let me show you one image. This is an exam we had. This is the actual image that we got, and you can see in reality I think it's most close to a Waters view, but it's way too steep. And so what happens is in this view here, the structures that we really want to look like, in this one in particular, we were trying to see a zygomatic arch fracture, but the zygomatic arches are overlapping with the skull laterally here and here, and it's because we're just too steep on our angle. So this zygomatic arch view here, this Waters view here, we can still see the zygomatic arches here and here. And again, it's not the ideal view to look for a zygomatic arch fracture. I would use a basal view, but this will see some of those fractures, especially if it's pretty displaced. So it's important to make sure that we angle our images correctly so we can get a good view at all of these sinus and trauma issues that occur. Keep in mind, you know, when we're using plain film here, and the things that you're going to find, take them with a grain of salt. So if you are pretty suspicious for a fracture in a patient, you really need to do a facial CT. So just because you have a negative plain film exam does not mean that they don't have a facial fracture. So it has to really be correlated clinically. If we do see the fracture on plain film, that's great. You can treat it based on the plain film, but you can see there's a lot of overlapping structures here, and so our sensitivity is not near what it is on a CT examination. All right, this has been Dr. Mays talking about some facial x-rays. Thank you for your time.